So cancer is a disease of aging, and cancer is a hereditary disease for a lot of different kinds of cancers. Not all, but for a lot of them. And so prostate cancer is one of those that we know for sure that there are some genetic variations that are passed down from our parents that would make men either predisposed or not to get prostate cancer, and also would predispose them to get aggressive prostate cancer. And so, for example, if you have a father, an uncle, grandfather, if you have family members that have had prostate cancer, and beyond that, if you've had women in your family that have had breast cancer, then that increases your chance as a man to get prostate cancer, and to get it even younger than other races would. And so, um, certain things that we look at in the lab and in the clinic at City of Hope is really trying to understand what those hereditary factors are, and then how you can target them with drug treatments specifically. So, for example, we have a clinical trial that a team of us developed, and we are looking at the ability of something called PARP inhibitor. Not to get too technical with you, but PARP inhibitors, if you want to Google it, they are at the forefront of prostate cancer treatments right now, and especially a few running in clinical trials. And so there is a hereditary disposition. There is a mutation on the BRCA gene that leads to PARP inhibitors benefiting any person that would have that BRCA mutation. What we're doing in our clinical trial is we are using a PARP inhibitor called talazoparib, and we are not only providing that to patients that have this BRCA mutation, but we are extending it to patients that may not have that mutation. And the reason for it is because, and I definitely don't want to get crazy technical, but the reason for it in a nutshell is we know in cancer that there is an interaction between PARP inhibition and androgen receptor function and reaction to treatments. And so you may have heard of androgen and androgen receptor when it comes to prostate cancer. It's really the fancy way of saying testosterone, and prostate cancer needs testosterone, or it needs androgen and androgen receptor to function and to grow. And so what we want to see in this clinical trial is if we use PARP inhibitors in combination with hormone therapy that's targeting androgen production, androgen receptor, will we see better treatment and better response to the drugs in those patients? And the extra cool part to me is we know that there are variations in DNA segments that affect androgen receptor function in African American men. And so, for a specific mechanism that I won't dive into, it involves trinucleotide repeats and segment links and all this. But because of these variations in androgen receptor in African American men that we know is associated with their ancestry and what they've inherited in their own DNA, this drug should work better in African American men, and we will be able to tease that out in this clinical trial. And so it's an opportunity for African American men who have prostate cancer, who have not developed castration resistance yet, but who do have metastatic prostate cancer. So at that point, there is not a cure, right? And so you can go to your physician and you can get a standard of care therapy, or you may want to consider this clinical trial where you would receive standard of care therapy, and then also, as I said before, this VIP access to this new drug, this PARP inhibitor that we think may improve outcomes in men.